representative for Burke to talk to us about it.
Hi guys, I'm Tiffany Lau. I'm the chief resident at Burke Rehab. So really just about our program. So we're a freestanding acute care or a freestanding rehab hospital. We have 150 beds. We have a spinal cord injury unit, a TBI unit, a cardiopulmonary unit, and an orthopedics unit, and then also a stroke unit. So our residency program, we have inpatient experiences and outpatient experience that are just kind of widespread and diverse. And we have attendings in both physiatry as well as neurology. So our program is growing. This year we had our first class of 6 PGY2 residents, and then the previous classes before that were 4. Our program was started in 2016. We're located in White Plains, New York, which is about an hour north of the city by driving. And we're, like a really collegial group in terms of working well together. We kind of all support each other. And then, so our program, we're really focused on both neuro rehab as well as musculoskeletal. We get a lot of musculoskeletal exposure in our outpatient clinics. And just a really collegial environment between the attendings and the residents. So we are focused on this year on expanding our program and working with our didactics curriculum in terms of changing it a little bit. So we do like a block system with our didactic schedule. We do, our stroke block is coming up first, and then we do an MSK block, EMG, and then we do like an SCI block and just kind of peds. And then we just kind of go like that throughout the year. We follow Cucurullo pretty closely. And there's a lot of experiences and networking experiences we have with, in terms of being able to go to conferences and things like that, not obviously now because of COVID, but everything, is going kind of on its way, hopefully, and getting better in New York. So yeah, feel free to ask any questions you have about our program. I moved personally from Kansas to New York, so that transition was good. So I can tell anybody about that as well. And that transition moving from the Midwest to the East Coast. So. And so that's it for what I have on my presentation.
All right, thank you, Tiffany. We don't have any questions yet on the chat, so if anybody has questions and wants to want to use the chat, feel free to use the chat, and I'll kind of just chime in and let you know if we have anything. But other than that, we have 20 minutes per program, so if you want to just kind of, there you go, we have some questions coming in now. So can you see the chat box, Tiffany?
Yeah, I can.
All right, so I'll let you handle it.
Okay. So yes, the PGY2 experience is both a mix of inpatient and outpatient. So we are kind of moving towards the system of 8-6-2. Where you have 8 months of inpatient, your PGY2 year, but we're trying to get away from that. So as we get more residents into our program, we're kind of moving away from that. The mentorship is really great. So Dr. O'Park is my mentor in the program, and she's a really renowned physiatrist in the field of sports medicine, because that's what I want to go into. The changes that we see moving forward in the program, so as I mentioned, it's expanding. So each class is going to have 6 residents. So that's just going to increase the manpower, and it's also going to decrease the frequency of our calls. And then also just kind of having a bigger program and a more widespread, variety of sites. So our didactic schedule, so we have Wednesday afternoon didactics, and then we also have like supplementary sessions where we have like hands-on sessions with the EMG and ultrasound. And sorry, it's like flying by. Okay, let's see. Yeah, so our didactic schedule, there's two times per week. So we have hands-on, the ultrasound lectures and everything like that. No, our residents don't have any trouble meeting procedure numbers. So I'm just starting my PGY4 year now, and I need 5 more EMGs and I'm done for the year, or done for my residency program. So a lot of our residents have gone on to do fellowship programs typically. So last year, our graduating class recently, one matched into sports, one matched into SCI, and one matched into TBI, and the other one's doing a non-accredited pain fellowship, and that's pretty much how it's been across the board. So we don't moonlight at Burke. The PGY4s, it's kind of in the works about moonlighting, but as of now, we're not moonlighting. So in terms of conducting the interview process, most likely it's going to be Zoom or some kind of virtual format. I don't think we're still bringing people into New York because it's kind of tricky with Governor Cuomo and everything like that of how programs and people are coming into the hospital. We do have an extensive amount of EMG training. So we get a couple of different EMG blocks where basically all you do throughout the hospital and throughout your whole day is you cover all of the EMGs in the inpatient clinic or in our inpatient hospital, and then also in the outpatient hospital. So you're just doing EMGs all day on that rotation. This is Jesse's question. Yes, there are many sites we go to right now. We're kind of having some issues with our sites because of COVID and coronavirus. So right now, we're only able to go to a couple of our sites. So we're going to like a Westchester Sports and Spine site. And then we're also going down, because we're affiliated with Montefiore. So we go down to the Bronx and we rotate down there because their outpatient clinics are open as well. They are a little bit spread out. So the Bronx is about maybe 30 to 45 minutes from White Plains, which is the main hospital, the main Burke hospital. But some of the other sites are within like 10 to 15 minutes. Let's see. So yes, I'm sure our program will definitely consider the challenges that the current PM&R and medical students are facing in terms of not really having hands-on clinical experience and things like that. So I definitely think Dr. Seidel, our program director, is taking that into account. For me, the best and strongest aspect of the program is definitely the morale and collegiality of our residents and my co-residents. Like, so I'm on call this evening, and then a lot of my co-residents are still here helping me out, just because, not that I asked them to, just because that's kind of how the culture is at Burke in terms of we help each other out, you know, when one of us gets really slammed, and that's just kind of how it is. And so that, I think, is the strongest and best aspect of this program. The Burke itself, it has TBI as well as a sports fellowship in-house and here. And those fellows, this is our first year having those fellows, but we've already integrated them into our didactic curriculum to help us out. So for me, I chose Burke because I felt like it would make me a really strong physiatrist, being trained in both inpatient and outpatient, and also just kind of the area is just gorgeous up here. It's a really pretty campus. It's a beautiful hospital. Let's see. How's the support from the faculty, especially in helping residents? So for me, and I know for a lot of my co-residents and co-PGY4s, there's a lot of mentoring that goes on in terms of, you know, if you link up with an attending. For me, it's Dr. O'Park. She's helped me so much in terms of my sports fellowship application and just kind of helping me through that whole process, telling me, like, checking in with me how, you know, like I need to, you know, increase what I'm doing in terms of sports coverage or things like that. And like, I know that, you know, when my co-chief is going into pain, and like her mentorship process has been similar in terms of, you know, everyone coming and helping her through that process. Okay, let's see. Do most of the residents live in White Plains? So yeah, we actually have housing in the back. We lovingly call it the Burke dorms because all of us live back there, most of us. Like, I think a few that have pets can't live back there, but the majority of us live behind the hospital. So it's like the Burke dorm. So it's kind of nice. You see all your neighbors are all your co-residents and everything like that. So living in White Plains is really nice. It's about, so you can take the train down to the city or you can drive. It's about a 45-minute drive down to the city. But it's suburban enough for me because I'm from Kansas and I'm used to like not paying for parking, all of these things. And White Plains is that nice balance of it's rural enough, but it's still city enough, and you can get to New York City if you really want to in under an hour. So the cost of living in White Plains, most of us live in the back, so that makes housing pretty affordable, but the people that live off campus, most of them have spouses or things like that to kind of help with the rent, because it is a little bit more expensive up here, but definitely living in the back helps in terms of cost. So for the Burke dorms, like for my 1-bedroom, I pay like $13.90 a month. And then the opportunities for sports coverage as a PGY 2 through 4. So right now it's kind of a mix right now because a lot of things are closed and a lot of like sporting events aren't going. But pre-COVID, we were covering sports, like basketball, high school football, college soccer. We did some MMA events. We covered the New York City Marathon. We covered triathlons, Ironman, Special Olympics. We covered all those things pre-COVID. And there is adaptive sports that's affiliated with Burke that we also do like coverage for that. So the next question is, are there adaptive sports? Yeah, Cynthia, there's adaptive sports, and like Burke is actually a huge adaptive sports. We're affiliated with Move United. So we do have a lot, like we have our therapeutic, our recreational therapists, they help out a lot with that. And we actually run a hand cycle clinic and a lot of different like adaptive sporting events. So we do like the wheelchair games where it's like basically kind of like an like Olympic event for wheelchair athletes. We also do, you know, a bunch of different like adaptive boxing. We do adaptive skiing and those types of things. So I did my PGY 1 year. Question is, where did I do my PGY 1 year? Is there anything I would have done different? So for me, for my PGY 1 year, I did general surgery because I thought I might have wanted to do surgery. And so if I could have done something different, so in terms of doing anything different, I don't think I would do anything different because I've had a really good experience to where I'm at right now. I mean, there's definitely been challenges along the way, but I think overall my experience has been positive. So with it, Paul, with it being a relatively new program, there's a lot of like, you have a lot of voice in this program. Like last year we told Dr. Seidel about, you know, like the didactics and how we wanted to change it. And then this year it in real time, it got changed. Like we told him, you know, we didn't like Friday morning lecture because it was hard to get, you know, from the floors to clinic and things like that. And so we just basically scrapped that and kind of consolidated it into another lecture. So the changes that you want in a program are in real time. And like Burke is a really unique place because it is a small hospital in that sense that the CMO, Dr. O'Park, who's also my mentor, she'll come to morning report and she'll see you and you see, you know, like your CEO, you see your CFO, you know them on a first name basis. Like you can compliment their sneakers because you know the CFO like is a big sneakerhead. So like that place, Burke is really unique, and it's kind of, you know, you don't get that like peek into the admin side anywhere else because, you know, I don't know another hospital where you would know the CMO on a first name basis or you know the CFO on a first name basis. Neil, is there ever any difficulty competing for opportunities with other programs in the area? In terms of like, we're actually see the other New York residents a lot because there's a lot of programs in New York. In terms of competing with them for anything, I don't feel like it would be a competition because in just generally in rehab, most people are pretty collegial. And so I know like a couple of like the Mount Sinai residents or like NYU residents, we're actually, like we're good friends with them, and we, just collaborate on a lot of things. So it's always pretty just like collegial in terms of just in general, like the whole like New York Society of PM&R is like a group that like is a chapter just of like just a different New York program. So we see all the New York programs at those meetings and all the residents from those meetings. So we know them, and we hang out with them as well. So. Any other questions, guys? Sorry, I just kind of like was rapid fire going through the questions.
It's 7:22. You have 3 more minutes left.
Okay. Thanks, Vinny.
You are very welcome.
And feel free, I'm gonna put my, Vinny, can I put my like email in the chat and they can email me, or I can put stuff?
Absolutely, you can do whatever you want. The floor is yours.
Okay, so feel free, guys, to email me. It's tlau@burke.org, and just feel free to email any questions you guys have about the program. And I know it's hard right now because you guys can't actually physically be here and physically see the campus. We're working on getting like a video or some more like virtual things that you guys can like see and kind of experience the Burke campus, because it's a gorgeous place.
Looks like you got a couple questions there from Josh, I believe.
Maybe
Josh Lewis. Can you briefly touch on the type of research opportunities at Burke?
Yeah, gotcha. Okay. So with the research opportunities, there's a lot. So on the actual Burke campus, it's not affiliated with Montefiore, but there is like Cornell. The research side of Burke, there is actually a research side, but from like, there's the opportunity for like bench research over there, as well as like, that's where all our robotics are housed and things like that. So we can get in touch with them, and like they tour us through that side of the Burke campus. And there is actually like, there's an exoskeleton, and like we have walk bots over there and everything like that. So there's opportunity for research here.
Good. And looks like your last question is, what rotations do you suggest fourth-year students to have that would increase the skill set and complement career in PM&R?
So I think if you have time, it'd probably be beneficial to do some type of radiology. And it also kind of depends on if you want a freestanding or, like a hospital-based PM&R program. For us, like radiology would be super helpful, because sometimes you want to see what the stroke looks like on CT or things like that. And so I think if you have the time, that would be helpful. I also think we get a lot of wounds in terms of like SCI patients and like just the different kind of ortho patients. Sometimes we have wounds as well. So like if you want to do like a wound care rotation, I think that'd be good. And then also some other things, just like if you are interested in adaptive sports, definitely try to like, there's adaptive sports programs everywhere. So just like look one up and like even try to start like volunteering with them or things like that.
Awesome.
So.
Very good. Well, we are almost done with your time. So I think we really appreciate your presentation. I think we had some great questions. You have your email there, and please reach out to Tiffany, Dr. Lau, and then she can answer all the questions, and also make sure that you follow on the website as well.
Yeah, and if you can't, if that email doesn't work, if you want to do Twitter, I do Twitter as well, and Instagram. So feel free, just look me up and ask your question. I don't mind.
Great. Well, thank you very much. We appreciate your time. I hope you have a nice evening.
No problem.